Buddy, welcome to this special edition of We Gotta Talk. I'm so excited about today's episode, which is the third in a three-part series that we released over the past 2 weeks, specifically about COVID. As many of you know, I'm located here in Florida, which is the hotspot for COVID. Unfortunately, we've been seeing just a tremendous number of cases. And today, I'm so honored that we are joined by Dr. Ashley Hill, who is the medical director of Advent Health's Department of Obstetrics and Gynecology. In short, he is the person you want to hear from if you have any questions whatsoever about pregnancy and COVID. So Dr. Hill, thank you so much for talking to me today.
Sonia, it's always good to talk with you. Thanks for having me.
I appreciate it. This was short notice. You know, I realized the need for this kind of information, Dr. Hill. I have relatives in various parts of the country. And as always, Florida has the dubious distinction of sort of leading the country in some of these less than desirable milestones when it comes to COVID. So you specifically are dealing with pregnant women and to an extent seeing babies and how they're impacted by this virus. I have asked this question to both the speech pathologist and the ER nurse that I interviewed because I feel like it's the most impactful way to talk about this right now. How bad is it from your viewpoint?
So you mentioned we're from Florida. I've lived here over 30 years. I've been through dozens and dozens of hurricanes. So for the last year and a half, I would consider COVID a tropical, in terms of pregnancy and in terms of my practice, all right? A tropical depression, a tropical storm. It is now a Category 4, Category 5. It is terrible. It is heartbreaking. And another way to explain this is for the last year and a half or so of the pandemic, I personally have had many patients with COVID, but only one of those has been on a ventilator, all right? So the other day I took call, I had 4 patients on the ventilator, right? I had 9 patients with COVID in the hospital. So it's and other places around the country are reporting a record number of pregnant ladies on ventilators or in the intensive care unit. So this has become a really, really, really huge thing for us.
Yeah, it's unfortunate. And I have been asking medical professionals to provide a picture for us if there was an impactful story or an interaction you had with a patient that might really help illustrate for us what it's like to go in and see people suffering with this. I think the benefit of perspective in your case is tremendous. So of course, without revealing anything overly personal, do you care to share any particularly impactful experiences you've had?
Well, I would. So let me back up just for a second. So one of the most amazing things, and I love my job. I pick the best job in the world. I will challenge anybody. I've got the best job. I love my patients, the things I get to do every day to help people. It's just fantastic. But I had something after 28 years of practice and 30 years of delivering babies that happened the other day that was actually one of the most impactful things I've ever had happen in my career. And it still affects me. It's very bothersome. I will leave this out by saying that the ending ends well, okay? So please don't anyone, this shouldn't be a trigger for anybody. The ending does end well. So we had a patient, and I'm gonna say she's 28 weeks pregnant, which you could say 6 or 7 months pregnant. Some people say it that way. Baby's very small, a couple pounds. She's in the intensive care unit, not vaccinated, which is important. Before they put the tube in her throat, because the virus had affected her lungs, she said, I wish I had had the vaccine. I wish I had received the vaccine. And they said, ma'am, we're very sorry. So the doctors and the nurses and the respiratory technicians put the tube in her throat, paralyzed her, put her in a coma. You have to do that. And then we monitored the baby. So we have an entire team taking care of this lady, and the team was doing a phenomenal job. So I'm on the labor unit, and I'm checking on my ladies, and I get called stat to come to the intensive care unit. So I ran down the hall to the ICU with my team, and the doctor there, a very nice man, said to me, we're going to try to turn her over on her stomach, and if that doesn't work, she's probably going to die, and you're going to have to take the baby right here in the intensive care unit. And we know not even time to go to the operating room. We don't do surgery in hospital beds. We do them in operating rooms. So I took the scalpel in my hand, and I was ready, and we were ready, and the whole team was ready. And thankfully, it was like watching. I don't know how to even describe it. The monitor would show that the oxygen levels were just slowly coming up, slowly coming up, slowly coming up. And he looked at me, and I looked at him. I said, "Just wait 2 or 3 more minutes." So imagine there's a whole team outside of the ICU ready to go, ready to come in and do the surgery. And I held my hands up, and I said, 10 minutes. Give me 10 minutes. All right. And as the oxygen levels came back up again, we breathed a sigh of relief, and I thanked him very much, thanked the team, and we left. We had to do that 5 other times with this lady. And finally, after 2.5 weeks on a ventilator, I'm happy to say she is off the ventilator. Now, I don't know how she will do. Her lungs may be damaged. I don't know any of that part, but we did end up having to take her baby early. And those are the decisions that we are making in the hospital now. And I'm 97 to 90% of the patients who this is happening to are not vaccinated.
And you said that patient in particular was exceptionally young for as far as COVID risk factors that we've been told.
Well,
27.
She's young. Well, she was 27 weeks pregnant, but I can't give you the age.
Okay.
But she was a young, healthy lady. I can tell you. Someone out there might be saying, "Well, yeah, she's probably got obesity or high blood pressure, diabetes." We are now seeing this in young, healthy, fit women, and that's a big change from before.
What is particularly gnarly about the Delta variant, and you can speak specifically, of course, to the types of patients that you're treating. This seems to be like a take no prisoners type of strain.
Yeah, and I don't know the answer to that from a scientific perspective. I don't know if we know the answer to that as to why it attacks in a more virulent way. I don't know. I don't personally know the answer to that. I know the clinical effects of it are that we see lots of people go from the sniffles, a cold, sneezing. They call, they say, I'm going to go get COVID tested. And I said, please go do that. Isolate yourself, wash your hands, all that. And then they call back a couple of days later and say, wow, now my lips are kind of blue and I can't catch my breath. And then 2 or 3 days later, they're on the ventilator, or at least on oxygen in the intensive care unit. That's very different than what we saw when this whole thing started.
Yeah, it's terrifying. I mean, you tend to be exposed to the types of content and news that your circles are exposed to. And as moms, we're always sharing information. And I will tell you, even from the ground level, there's a level of fear about this that is just markedly different from last year. And it's not only because, it's not only because of what you're saying, it just seems to be impacting everybody in every group in a really much more severe way. I mean, I think words of encouragement is the wrong way to word this question, but like, what can you tell people that will give them hope? Because I know from my perspective, sending children into this world feels very unsafe right now.
The conversations have changed a lot in the office. So I'll go back to my hurricane example. We used to tell people, bring in the lawn furniture, just, things will just be a little careful. Now we're telling people to evacuate, get out, right? So it's a big difference in what we're saying. We're now telling everyone, get vaccinated. And all the major organizations, all of them, the American College of Obstetricians and Gynecologists, the Society for Maternal Fetal Medicine, the CDC, AHMG, Advent Health, we are all telling people, pregnant ladies, no matter what stage of pregnancy you're in, get vaccinated. If you're thinking of becoming pregnant, get vaccinated. That will help prevent most of this, if not nearly all of it. And the rest of it is the same old things we've been telling people: wear your mask, wash your hands. I'd like to say, I thought about this the other day when I was making dinner. I think the tendency for people is to wash their hands, they just kind of zip, wash their hands. I kind of think of it as when you're cooking chicken for dinner. You wash that piece of chicken for like 30 seconds, right? You want to get all the germs off it. Same with your hands, and then socially isolate. And so I think those are the main things. But I think we can get past this if, I guess I'd like to say, if you kind of think of it as, kind of loving your neighbor, right? Caring about your neighbor. If you don't care to wear a mask or you don't care to be vaccinated, we live in a country where that's your right to do that. But please think about your neighbor and your family and your friends and other people that are in your community, and do those things for them.
Mm-hmm. Let's speak specifically to the vaccine hesitant mom. I know we're told you can't even have cold cuts or you could hurt your baby.
Right,
and you can't even have caffeine, it'll hurt your baby. So it is naturally a stretch for a pregnant woman to be told all of a sudden it's this vaccine, which also features relatively new technology, at least as far as how it interacts with our bodies. Oh, no, it's totally fine. Like, I get why that's a stretch. What information can you provide to sort of prove how safe this is? And with the full realization that this is still a relatively new to market shot.
Well, my wife and I are both doctors, and our kids are in college now, as of this week, actually. So we talked about it. What would we do? And I have to be honest with you, when the vaccine first came out, we had a lot of conversations about, this is new technology, not so much new technology, but it's just a rapidly developed vaccine. Right. It's now, as of a few days ago, FDA approved. Right? The Pfizer vaccine is FDA approved, so that process is very rigorous. They don't just hand that out to every medicine. It's even got a brand name now. It is not a live virus, so there's no risk of it infecting your baby. All right. It doesn't change your DNA or the baby's DNA or cause any permanent changes. All it does is set your body up to have an immune response. So we've been using vaccines for years, and we have diseases that most folks watching probably wouldn't, even as a doctor, I've never treated, like polio and other things that were nearly eradicated, at least in our country, from the use of vaccines. So vaccines are not a new thing. They've been around for a long time and they're effective. We use them in pregnancy. We give something called Tdap, which is for whooping cough. We give that to pregnant ladies. We give flu vaccine to pregnant ladies every year. I give hundreds, thousands of doses we give out of flu vaccines. So I think for the vaccine hesitant mom, I trust this vaccine. All right. And if I were a mom, I would trust it. There are at least, well, let's put it this way, there are 150,000 women who have registered on this particular vSafe site. It's called vSafe. Now, that's only the people who have registered. It's probably 5 times that many who haven't registered. And we just haven't seen problems from it. So we're now
So there's
encouraging.
no case that you've seen where a pregnant woman, and again,
No.
speaking purely from personal experience, had a reaction that's impacted her or her baby.
I haven't even seen, knock on wood, an allergic reaction to the vaccine. Now, yeah, I got mine and my arm hurt for a couple of days. It wasn't, right. I couldn't exercise for a couple of days. But other than that, it's just not how it works. It sticks around on your arm. Your body creates the antibodies, the protection, and then the vaccine just disappears. So again, I saw a pregnant lady the other day in my office. She's taking a supplement that I have never heard of. I had to look it up on a search engine, and I said, this supplement, I cannot tell you whether it's safe or not. I don't know anything about it. She said, well, I heard somewhere that it helps keep my immune system high for my baby. I said, I can't tell you that. There's no research on this at all. But she won't get the vaccine, and to me, that I just don't know how to get past that.
Yeah, oh gosh, I really, it's just so touchy. I'm in the midst of a population of women who feel very strongly both ways. I'm vaccinated, my family is vaccinated. I believe that this is the step that needs to happen for my family. But it has become such a difficult thing to talk about because there is a fear that won't go away associated with this vaccine. What you've provided has been really helpful, though, as far as information. Now, if I'm listening to a doctor who has seen multitudes of patients, to me, it's enough to hear you say, I have not even seen a single reaction to it. It's heartening to me to hear that, but for some reason there seems to be a wall. Do you attribute that to anything in particular? And this doesn't have to turn into a political conversation, but you do, I'm sure, as you're treating women here, many of their concerns and questions when it surrounds this. So what is it that they keep saying to you?
I think it boils down to the individual woman's assessment of her risk of getting COVID. Okay. So to put it the other way, when COVID first came out and the vaccine first came out, I had a lady in my office who was pregnant, and I said, are you going to get vaccinated? She goes, I'm not sure what to do. I said, well, what do you do for a living? She goes, I'm a nurse on a COVID unit. I said, I will drive you down myself. Let's go get the vaccine like stat, right? I mean, she's a nurse on a COVID unit. She's super at risk. Another lady, a couple of patients later, said, I'm a stay-at-home mom. I'm a homemaker. I work. I have several children. How about your partner? Well, my husband, he works in a retail business. I said, I think you should get vaccinated. You are at risk because he could bring home COVID and give it to you. So the problem, I think, is that many of the patients that I'm seeing lately with COVID who are unvaccinated, they aren't particularly at risk. They stay at home, or they're working from home in some capacity, but somebody else brought it to them.
Right.
And that's the problem.
Yeah, the insulation is now a myth. Like none of us is insulated from this virus at this point. I mean, right? Unless we're hermetically sealed alone in our home with no other human being. I mean, right? Isn't that isolation a total myth 2 years into this whole thing?
I don't know how you could be without obviously going bonkers. I don't know how you could. I mean, how many people out there? I mean, I have to go to work, I have to see patients, but if if I were retired, I'd have my groceries delivered. Maybe you could do it, but after a while, what would that even look like, right? I mean, that's crazy.
Right. Yeah. I mean, I've had this conversation so many times with friends and family. I mean, it feels impossible that I haven't been exposed at this time. Now, have I ever been symptomatic or diagnosed? No. But I mean, just based on where we are geographically and looking at the numbers and knowing that it's probably underreported as well, right? We're probably not even aware of the true scope of this virus. It almost feels inevitable that we've all, at least if we haven't been, are destined to become in contact with this virus.
I think it's going to be. So my daughter the other day asked me about September 11th for a school project she was doing, and she said, "Do you remember where you were?" I said, "I was doing a hysterectomy in operating room when I heard about the planes." And she goes, "How do you know that?" I said, "Well, honey, people our age, adults often remember huge major events in our life. We can tell you what we were wearing and where we were and what the weather was like, when the space shuttle exploded or when whatever happened. People our grandparents' age can tell you when President Kennedy was assassinated. I can tell you we're going to remember this forever. This is a pandemic. It's a big deal. And so I think the faster we can get past this and back to our normal lives and the things that we want to accomplish in life and is going to be critical for this. People are getting fatigued. They don't want to wear their mask. I don't want to wear my mask. I mean, I got to be honest with you, but I do. It's part of my job, and I feel responsible to do it. But I think a lot of folks are getting fatigued by this. And I did hear the other day someone say to me, "Well, only 2% of people die from this. So what is the big deal? 2% is not a high death rate." That's not how to look at it. And so I'm going to go one more time, if you'll let me, one more time back to my storm, analogy or metaphor, or whatever. If you told me that only 2% of people die from a hurricane, that doesn't sound too bad. But if 90% of the homes in Orlando were knocked down, then I have to say that's life changing. That's devastating. So we know that people that get this disease, sometimes they have to use oxygen probably the rest of their lives. They can't walk up a set of stairs. They can't go to the gym. Go on their lifetime dream trip to Italy. I mean, this is a life changing event for a lot of people. So it's not just the death rate; it's the infection and the risk of lifelong problems.
Right. Let's talk about specifically pregnant women and how symptoms are first appearing often in their cases. Sure. What can people look out for, and what seems to be specific to that demographic?
Well, so the good news is that most people that get this are going to do okay. All right. So this is I don't want folks watching to think that if they get a positive COVID test, it's all over for them. They're going to go on a ventilator. That is not the case. There was a study that came out recently that showed that you're about, I think, 6 times more likely to go to the intensive care unit and about 15 times more likely to go on a ventilator if you've got COVID and you're pregnant versus if you're pregnant and you don't have COVID. So those are big differences, but there's still the overall numbers were not giant, right? So
can I hop in with a quick question there? Is there some sort of is it because something happens to our lung capacity when we're pregnant, or something happens to our bodies that makes us more susceptible to those more difficult symptoms and side effects of COVID? Why is that happening? That women are in need of more intense treatments when they have COVID when they're pregnant?
So Sonny, I'm a teaching doctor, and that's a med student resident question. That's a good one. So I like it. So pregnant ladies are very different, and they have to be, otherwise their body would attack the baby. Okay, so your immune system when you're pregnant is just different, and so we know that you're more immune, you're more susceptible to certain conditions. For example, chickenpox can affect pregnant ladies much worse than non-pregnant ladies. So it's probably immunologic. I don't know if we really understand. I mean, a lot of the immune aspects of pregnancy are still being figured out. But we know that pregnant ladies constitute one of the at-risk populations. So imagine this. Imagine I'm a geriatrics doctor, and I'm taking care of a senior citizen who's 75, 80 years old, who's got all kinds of medical problems. They're considered at risk for COVID. So are you if you're pregnant.
Wow. It's that similar of a comparison. It's that similar of a situation.
Yeah. You're an at-risk population because of the probably the immunologic changes in pregnancy and the effect that the disease has. So again, to get back to the original question, if somebody's at home and they think they've got COVID, certainly they're drive-by testing. You can call and get tested, and that's easy to do. And then call your healthcare provider and get some advice on how to isolate and whatnot. The main thing is to stay away from other people, stay at home, stay hydrated. But you can course, at our practice, we have a doctor and a midwife on call 24 hours a day. You can call whenever you want. But if you're feeling short of breath, if your lips turn blue, if you just, you get up out of the chair, you walk to the kitchen, you feel like you're winded, those are the times to call, because you have to have a certain oxygen level in your body. You're breathing for your baby, right? Baby can't breathe, so you're breathing for your baby. And if your oxygen level is too low, not only is it dangerous for you, it's dangerous for your baby. And that's when we put people in the hospital. So again, on call the other night, nice lady called, said, I've got COVID. I was doing okay. It was just felt like kind of a bad cold, and now I'm short of breath. So she came in and we put her on one of those little oxygen prongs in her nose. She did great. No problem. All right. So she was there for a couple of days, no tube in her throat, no getting paralyzed, no going into coma, no problem, but still scary. And she had to be in the hospital, and there's an expense and time and effort and all that to that.
Yeah. I mean, gosh, and an additional level of exposure to other things that are, things that are running around hospitals, other bugs.
Well, and part of that is I worry it's not just the COVID folks. So, I thankfully, knock on wood, I'm healthy, but let's say that I have a bad heart attack at work this afternoon, and I need to go on a ventilator. There's none left.
Right? How is it looking right now at Advent? Are you able to say, or do you have hands-on numbers of how many are left, how many ventilators are available still if they're needed?
So I have to tell you, for disclosure, right? I'm an Advent Health employee, but I will tell you, my employer has done a phenomenal job, our leadership team, keeping us up to date on things. We get daily emails, several daily emails. I have not looked at the email today. I cannot tell you where we are in terms of ventilators. There's something called ECMO. ECMO is an amazing technology where actually they can stop your heart, stop your lungs, and put your body on a machine that circulates your blood and breathes for you, and circulates your blood for you to let your lungs rest and let the antibiotics work. And sometimes with COVID patients, we have to use that device. I can tell you, around the country, the ECMO machines are at an all-time high capacity for being used for COVID patients. And so if somebody else has a heart problem and needs to go on an ECMO machine, they just die. There's no place for them to go. So the societal risk from this extend past just you and I getting this disease. It's deeper than that.
Sure. Are you able to assess, based on the patients that you've either personally treated or seen, the percentage of women, pregnant women who are vaccinated receiving treatment in hospital versus the percentage of women who are unvaccinated receiving that type of treatment?
Nationally, it's around 1 in 5 are vaccinated, but it's going up now, in part because of discussions like this, and which is great, and I appreciate it. But I would say we're probably a little higher than that. I'm very honored to take care of a lot of healthcare providers in my practice. My partners and I take care of a lot of doctors, nurses, sonographers, technicians, respiratory therapists, and they have a very high vaccine rate because they're firsthand seeing what's going on. So I'd say we're higher than that, but I can't give you an exact number.
Okay. Anything pregnant women should be specifically asking their doctors, midwives, care providers about that might, aside from the vaccination itself, that might help keep an eye on potential symptoms or other things they need to monitor?
I would say, Sunny, to have that risk assessment, to talk about it, and to go over things. Our job, what we've given really dedicated our lives to do, is to help keep people healthy, and when they get sick, to make them healthy again. And your doctor, your midwife, your nurse practitioner, your PA, they're going to have an honest discussion with you about this, and tell you, looking at your risk factors, should you be vaccinated or not. I think every pregnant lady should be vaccinated. And I want to add one more part to that. There's a rumor that somehow went viral, I don't know how, that the vaccine causes infertility, can cause miscarriages. There's no evidence of that at all. There's none. I don't know where it started, but you know how that goes. Sometimes things just take off.
Well, that's what I wanted to ask you too, because as people kind of segue in and out of this, they're catching different bits. It's got to be emotional on some level for you, someone who's dedicated their life to science and medicine, to not only try to keep up with the influx of patients that you're treating, but also battle the sort of political and societal arguments that are no doubt challenging you every day. And this is not to say, I'm a big advocate of listening to your body and listening to your intuition and, personalized treatment for people. And maybe what's good for me isn't good for you. I get that. But it's got to be kind of challenging in a lot of ways to navigate these conversations without just being completely emotional on your part and your colleagues' parts.
Well, I don't know, Sonny. I'm not sure that's true, and I'll tell you why. We get that about a lot of healthcare issues. I mean, people all the time do things that maybe aren't safe for themselves medically. You know, my doctor for the last 10 years has said, "Hey, you could stand to lose a few pounds," and I look at him and say, "By golly, I'm going to go to the gym tonight," and I do the best I can, but you know, I haven't lost many of those pounds, right? So people with diabetes don't sometimes they don't put the cake away. There are a lot of smokers still smoke. So there are a lot of things that we have conversations with people, and we're very non-judgmental about that. I'm not judging someone. If you don't want to be vaccinated and you're adamant about that, I'm going to treat you the same way. It's not going to change the way my partners or I treat you. We just really want you to be, and your baby to be safe and healthy.
And you're saying, repeating this one more time, because we covered this a little earlier in the interview, anyone who's vaccine hesitant, explain precisely how the vaccine works and why, in your belief, this is, and bearing out in all of your work, why this is not in any way damaging to either the baby or the mother.
So let's just go through it one by one. So the first thing is that it was produced using a technology that does not do anything to our DNA, the baby's DNA. It doesn't change us in any way. The second thing is it's in your body for a relatively short time, and then it dissolves and it sticks around mostly in your arm where you get it. It's not something that's getting attached to any part of the baby or the mom in a way that's harmful. The third thing is that there are at least 150,000 women who have reported their vaccine status and are being looked at for complications, and we're just not seeing anything significant from that. And we also know that if you get the vaccine and you do get COVID, which can happen. I mean, that can happen, right? You can get exposed and get it. It's much milder form than if you're not vaccinated. So your risk of harm and harming your baby and having a C-section and going on a ventilator and dying is dramatically increased if you don't get the vaccine. All right. And then the final thing is there's some evidence, I think, and I don't think we can say as much about this as we want to, but that antibodies might get passed over to the baby that might help protect the baby.
Yeah, gosh, I've read too many stories recently where you're hearing of 30-year-old mothers delivering and then passing. Or I personally know someone who knows someone. I know this sounds dubious, but it's legit. Who knows, this woman who's being kept alive, but is otherwise like brain dead, for lack of a better word, but her body's being kept alive just so that she can have a healthy baby they can deliver relatively at 40 weeks on time and safe. It's just, you hear that and that just adds a whole another level of concern and sadness.
It does. And I've been practicing 30 years. I lost count a long time ago. But I've probably delivered close to 8,000 babies by now. I've been doing this a long time. And this is the first time in my life, in my career professionally, that I've ever been afraid. And it's just it worries me because every day I see these lovely ladies I take care of. They're just such nice people, and they come in and I worry about they're not vaccinated, and I just worry, am I going to get a call in a week or two? They're in the ICU, they're on oxygen, they're very sick. It's really been a struggle.
I can imagine. Can you leave us, Dr. Hill, before we let you go, with any advice, of course, in addition to your suggestion about the vaccine, any advice or sense of hope that we as parents, even if we're not expecting at the moment, can sort of cling to get us through this difficult time?
Well, I think, like I said earlier, if we stick together as a country, as people, as family, friends, people care for each other. If you wear your mask, all right, the right way, which is, you know what? I've got a mask right here. Hold on, I'm gonna show you. Okay, so goes over the nose. I'm touching these guys like this. Okay, you can do the nose pinch thing if you got glasses, because I have glasses, they fog up. You can adjust it, then use hand sanitizer. All right, which I'm at home. I don't have any right here with me, but that's how you do it. This doesn't work. Okay, because you're breathing out your nose. I mean, and I don't know what that's all about. That's not going to work for anybody.
That's called when the kids come home from school. I joke, my son has like a beard. I'm like, just take it off your ears. You're in the car now.
The chin diaper. That's not going to work.
The chin diaper. The
chin diaper. But hand sanitizer is super safe in pregnancy. It doesn't go to the baby or anything. And wash your hands a lot, and just try to socially isolate. And I think if you're vaccinated, I'm vaccinated, I'm much less worried about getting COVID now. I might, but I think it wouldn't be nearly as bad. If you're vaccinated, I think there's a little more of a sigh of relief. But if you're unvaccinated, please be triple careful. All right.
Yeah, we're still waiting to get the latest news on whether or not young kids should be getting vaccinated too.
Right.
So I'm sure we'll be knocking down the PR department at Advent at some point
Yeah.
in the near future when that discussion comes to the surface. So,
Yep.
Dr. Hill, thank you so much for giving us some of your time today and for your knowledge. I really appreciate it.
You got it. Please be safe, everybody. Thank you.
Thank you.